Hello, anatomy students. This is our first set of video notes that you are going to use for the flipped classroom. So I'm going to run through the chapter 1 material, and you're going to watch this on your own time, or you are watching this on your own time, I suppose. And we'll be doing other stuff during class. So with that, let's go ahead and get started. So this is chapter 1, study of anatomy. And anatomy is the structure of the study of the structural basis of body function. We're going to do almost entirely anatomy. There will be some limited physiology because we'll talk about the functions of different organs and organ structures and cells, but the focus of this course is anatomy. We'll also touch on some functional morphology, which is the functional reasons behind the structure, evolutionary forces producing different structures in the human body. So anatomically, we can divide this up into gross anatomy, surface anatomy, radiological anatomy, systemic anatomy, regional anatomy, and histology, which we'll touch on briefly. Histopathology, the study of diseased tissue, and cytology, the structure and function of individual cells. Now, the methods of study include inspection, palpation, auscultation, percussion, and dissection. Now, other than dissection, these are the things that your doctor does when you go in for an exam or an office visit. Inspection, the doctor will look at you, make sure that you look good. Palpation, they'll feel in various areas, especially up around here, searching for swollen lymph nodes. Auscultation, listening to normal sounds. This is what they do with the help of a stethoscope. Percussion, tapping and listening. They'll often tap on the chest region and some other regions, looking for hollow spaces underneath, and then listening to see if everything's normal. And so these are modes of study that are employed in not only anatomy, but in medicine. There are a broad range of medical imaging technology that's available today, and it replaces a lot of what used to be called exploratory surgery, where doctors would have to cut into a patient to see what was going on. Now they can use various radiological techniques and medical imaging to visualize the structures underneath. So radiology is concerned with imaging. Invasive techniques involve some structure or some tool inserted into the body. Non-invasive techniques don't penetrate the body. Radiography is an X-ray or a radiograph. It may use a contrast medium for the visualization of hollow organs, and it may focus on tracers in the blood system if you're doing an angiography for the looking at blood vessels. Computed tomography scan or CT scan uses cross-sectional X-rays. The dynamic spatial reconstructor is a modified CT scanner that produces 3D videos to show motion and volume changes. Magnetic resonance imaging is for soft tissue visualization, and fMRI is functional moment-to-moment change, so you can actually see changes in the structures as they are operating. Positron emission tomography, or PET scans, use gamma ray detection and are a branch of nuclear medicine which involves the use of radioactive tracers in the subject. Sonography uses the reflection of ultrasound waves, and you're probably most familiar with this as a sonogram in obstetrics when you are looking at the developing fetus. They're also used in echocardiography or an echocardiogram to assess the condition of the beating heart as it's in motion. Now, there's some variation in human structure. Not all people have normal position of organs, and so you've got situs solitis, which is the normal arrangement. You've got situs inversus, which is the reverse position of organs. And then you've got situs perversus, which one organ is atypically positioned, maybe an appendix or some other structure that's not where it's supposed to be. Now, living things are organized into a hierarchy of different levels of organization. And so in anatomy, we're mostly going to be working with tissues, organs, organ systems, and organisms. But if you go all the way back, you get to atoms. Atoms are arranged into molecules. Molecules, especially large complicated ones like proteins and carbohydrates, are arranged into organelles. Organelles constitute functional cells, at least in eukaryotes. Cells form tissues, tissues form organs, organs work together in organ systems, and then the collection of all your organ systems is the functional organism. So here's a diagram showing that relationship from atoms to molecules. This one has macromolecule thrown in. Macromolecule is just a big molecule like a protein, a carbohydrate, DNA molecule in this case. Here's an organelle that looks like a mitochondria. Cells, tissues, organ, stomach, digestive system, and then all your systems together form the organism. So those are the levels of human structure. The organ systems, we're going to be looking at most of these in quite some detail, so I'm not going to go into all of them right now, but here is an overview of the list that we'll be looking at later in the unit and later in the course. Got integumentary, skeletal, et cetera, et cetera. If you combine the names of two systems, you are insinuating or you're emphasizing their relationships between one another, like the urogenital system, the skeletal muscular system or the skeleto-muscular system, the cardiopulmonary system, because they work closely together. You can have two systems working together in closely mechanically and otherwise to perform certain functions. And we'll take a look at those, like I said, later. I've got a couple of examples here. We've got the integumentary system. For example, the skin, most of your outer coverings. And then we've got the skeletal systems, bones, cartilages, ligaments, etc. And again, since we'll be looking at these in more detail, I'm going to skip over them right now, but we will be back to discuss them in much more detail. A lot of times it's important to describe the position of a structure anatomically. And so all of the descriptions of position are generally going to be relative to what's called anatomical position. And it involves standing erect with your feet flat, arms at your sides, supinated, which means that your palms are rotated forward. Palms, face, and eyes are facing forward, and it provides a constant reference of body position. So the camera's, well, let me fix the camera. So anatomical position, palms, face, feet, everything's facing forward. And then everything's relative to everything else in terms of anatomical position. Here we've got a model, modeling anatomical position. This slide also brings into our discussion the three frames or planes of reference. So there's a transverse plane, a frontal plane, and a sagittal plane. And you can see that they're at right angles to one another, and that they describe the three axes over which we would want to describe the location or position of an anatomical structure. So the body can be divided up into frontal sections, transverse sections, and sagittal sections. The frontal plane here is going to divide the body into a dorsal and ventral aspect, or a front and a back. The transverse plane is going to divide the body into an superior and inferior portion, a top and a bottom, basically. And then the sagittal plane cuts down the middle and separates the body into a left and a right side. So those are the three planes of reference that are used to describe reference points on the human body. So as I mentioned earlier, the sagittal section, here's an example of what the human pelvis, female pelvis, would look like in sagittal section. You've got a right and a left portion. This one happens to be the right. If it's right down the middle, it would be a median or mid-sagittal plane, and you'd get two equal halves. But it is possible for there to be parasagittal sections where the two halves are not equal to each other. You've got the frontal or coronal plane that cuts it into anterior and posterior portions. Here's the frontal section through the thorax of human. And then you've got a transverse horizontal plane. We might, if we were doing microscopy, we might call this a cross section, but this divides up into superior and inferior portions. So here we've got a transverse section through the skull, showing the eyeballs and the nasal passages and the optic nerves and the brain stem and the cerebral cortexes here. Now, there's some additional terminology that we're going to introduce early and practice a lot. And these are frequently used terms that are used to describe the relative position of structures on the human body. So I'm not going to go through all of these, but I do want you to be familiar with all of these, and we're going to practice them during the unit so that you become comfortable with their use. So the terms are lateral, proximal, distal, ipsilateral, contralateral, superficial, and deep. These are all used to relatively describe the position of one structure to another. There are also terms that are used to describe the major body regions that I will want you to be familiar with. Again, we're introducing them early, and we're going to practice them a lot. And so again, I'm not going to go through every one of these, but I do want you to start to become familiar with the major regions of the body: the cephalic, the facial, the cervical, the thoracic, umbilical, abdominal, inguinal, etc. So arm is good, brachial is better in terms of terminology use as we get more familiar with them. Now these are anterior. These are on the front of the body when the body's in anatomical position. And here are the posterior regions that I want you to be familiar with. So the major body regions include the head, the neck, the trunk. The trunk itself can be divided into the thoracic and abdominal region. From there, on the abdominal side or on the anterior side, you can divide the abdomen up into 4 quadrants or 9 regions. And I've got a diagram of that, I think, on the next slide. Oh no, that's coming up later. This is just the list of the terms that were on the picture slides. So you want to know your arm, your forearm, your wrist, your hand, your fingers, and then the lower limbs, the femoral, the crural, the tarsal, the pedal, and the digits, also known as phalanges. So this diagram shows the abdominal quadrants and regions. Now the quadrants are easy. You've got right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Couldn't be simpler, very descriptive. The 2 lines meet right at the umbilicus. And from there, you've got references for some of your important interior structures. You've got the stomach and the 10th rib located in the left upper quadrant. You've got the superior spine of the pelvis located on the lower left quadrant. Oops. Now, if you divide it up into regions, then you've got 9. It's like tic-tac-toe. You've got 9 different regions that I do want you to be familiar with. You've got the mid-clavicular line, which comes down from the middle of the clavicle and passes vertically here. You've got the interturbicular line, and you've got the subcostal line. Again, I'm not going to go through all the terminology, but notice how it provides a framework for understanding the structures that are underneath. These are surface regions, and then deep, you've got the liver, the gallbladder, and the 10th rib, all in this epigastric region. You've got the large and small intestine in the umbilical region. You've got the bladder and the urethra in the hypogastric region. So you've got deep structures that are located underneath, if you will, these surface regions. But I do want you to be familiar with all of the regions and quadrants. All right, we're gonna finish up with body cavities and membranes, at least an introduction to the body cavities and membranes as we get to the specific organ systems. And we talk about the organs like, say, the heart and the lungs. We'll revisit how their membranes are arranged within their respective body cavities and what body cavities they're in. But to start with, it's just an overview. So we've got the cranial cavity, which is enclosed by the brain case, and it contains the brain, naturally. And then you've got the vertebral canal, which is enclosed by the vertebral column and contains the spinal cord. Both of these cavities are lined by membranes called meninges. And the meninges are surrounding the brain and the spinal cord and protecting it. And we'll talk about their names and their functions and their structures when we get to the nervous system. Notice that the cranial and the vertebral cavity are dorsal, that is towards the back, and then or a posterior. And then the other cavities that we're interested in are going to be anterior, the thoracic, the abdominal, and the pelvic. The diaphragm serves as the differentiator between the pelvic and the thoracic cavities. The thoracic cavity is superior to the diaphragm. It's also superior to the abdominal cavity. There are a couple cavities within the thoracic cavity, some subcavities, if you will. So there's the mediastinum, and within that is the pericardium, which is the chamber that the heart, not chamber, that's not a good description of it, is the membrane in which the heart is found. And then the pericardium, sorry, I just said pericardium, has the pericardial cavity and is also contains some pericardial fluid. Again, this is just an overview. We're going to go back over and describe in detail how these things fit together. The pleura are the membranes that surround the lungs, and they form the pleural cavity. They line the pleural cavity, and they also cover the lungs. And in between the two layers of the pleura, you will find the pleural fluid, which lubricates the lungs so that they don't chafe when they expand and contract. Same thing with the heart. There's two layers of pericardium with fluid in between that lubricates the heart so that it doesn't chafe or rub as it pumps continuously. Now, the main membrane in the abdominal cavity is called the peritoneum. And the peritoneum consists of a parietal and a visceral portion. And it's tough to explain, and we'll go back over it again when we get to the digestive system. But it's sort of split, and there's a parietal layer that covers the body cavity, and then there's a visceral layer that wraps tightly around the organ. And so the visceral and the pleural are right next to each other, and in between them is the peritoneal cavity. It's not a big air-filled space. It's a very narrow fluid-filled space because it's filled with peritoneal fluid. And again, this allows for the organs to move past one another without getting chafed or scraped or otherwise damaged. There's some terminology that describes an organ's position relative to the peritoneum. If it's retroperitoneal, like your kidneys, they are going to be outside the peritoneum. Oops. Intraperitoneal, surrounded by peritoneum. And serosa is another name for the visceral peritoneum that divides and wraps around an organ. So that's the visceral portion of the peritoneum. As I mentioned, normally the parietal and visceral membranes are pressed together with a little bit of fluid in between them. They're not attached to each other, but they can slide past one another. They can separate and create space, and these are called potential spaces. So there's the potential for space to form in between the parietal and the visceral membranes. It's possible for them to become filled with fluid or some other material, and that's not always a good thing. These terms are talking about how medical terms get put together. They're mostly Greek and Latin. There would be a root combining vowels, prefixes, and suffixes, acronyms, and then there's some eponyms, although those are on the decline of terms coined from people's names, like the discoverer, like what's an example? A fallopian tube. The circle of Willis is a blood vessel or a structure in the brain named after the people that discovered them. Fallopian tubes are named after someone who helped their discovery. So there is some terminology that goes along with medical terms, and it's mostly Greek and Latin, but that's what this is about. But this is not something you have to memorize. You do have to memorize the terms themselves, though. If you have any questions, please shoot me an email, and I will, if this works the way I'm planning on it, I will see you in class. Thank you.